All right, good news this morning. Santa Fe Imaging is the first place in the northern part of the state to offer what is called new high-resolution MRI technology to help fight against prostate cancer. Here to tell us all about it and how it affects you is Dr. Margaret Gallegos, the radiologist at Santa Fe Imaging. Good morning, doctor. Thanks for coming in.
Good morning.
Okay, so let's talk about this and the process that goes along with prostate cancer. First thing, we're just talking about this. Guys, usually around 50 or so, they get a blood test, and then there's some abnormalities, and that's kind of where the checking starts, right?
Right. So there's a blood draw called for the prostate-specific antigen, which if comes back elevated, then generally the next thing that people would consider and along with the physical examination would be whether or not to undergo prostate biopsy. Well, prostate biopsy does have some trouble in that 20% of men who undergo prostate biopsy who actually have cancer will be misdiagnosed as not having cancer.
That's 1 in 5.
Correct.
The biopsy misses it, and that's where this new technology that you guys have called the Endorectal prostate MRI comes in. What does it do?
So in the endorectal prostate MRI, we actually image the prostate using magnetic resonance imaging. It doesn't use x-rays, so it's not a radiation dose.
Okay.
And we do have a way to look at the prostate with this technology and basically identify areas in the prostate gland that are suspicious and that could be better targeted for the next biopsy, for example. We've had gentlemen come in who've already had 2 or even 3 biopsies that were negative, and this blood test keeps rising, so they still worry about the possibility of prostate cancer.
Okay, so we talk about the biopsy being 1 in 5 or 20% it can miss. Is the endorectal prostate MRI pretty much fail-safe?
It does have a high sensitivity for detecting lesions. And so what we do is when we know that a gentleman has a rising PSA, but they haven't been able to find it, is we look for the most suspicious area, report that back to the urologist in order for them to try and target that area in the next sample, because a prostate biopsy takes about a 1.5 centimeter plug of tissue out of the prostate, and about maybe 1 to 5% of the prostate is actually sampled.
Okay.
So there's a high sampling error rate just by nature of the biopsy.
Sure, I think that explains a lot of it. So what happens after the MRI if it comes back as something that is positive?
Correct. So if we find an area that's suspicious on MRI, then we'll report the area to the urologist, and newer technologies allowing people to use these images, even mapping it with ultrasound images to go after these areas of suspicion. So we hope that as we move forward with this, we'll be able to use some new technologies. There's even a prostate-guided MRI-guided prostate biopsy that allows us to actually do this procedure. Now that's in the future, but at some point we may be able to offer that too.
And I imagine with any cancer, with prostate cancer, the sooner you get this MRI, the sooner you detect if there's a problem and where it is, the faster you can go ahead and help cure people.
Right, and we hope that also to risk stratify patients, because not everyone with prostate cancer actually needs to have it removed. A good portion of prostate cancer can be indolent and slow growing, and for a gentleman who's, say, in his 80s, the risk of surgery outweighs the risk of the prostate cancer. But we can identify and help risk stratify patients who may have low-grade disease, and if that correlates to what we find on imaging, then they can just have a wait and watch procedure and not have to undergo a radical prostatectomy.
All right, and the great news about this is you're the first place in a northern part of the state to offer this MRI. It makes people's lives a lot easier. They don't have to drive down, particularly if they're older folks.
Yeah, exactly. We're very excited to offer this technology to people. I think it's time that we start focusing in on prostate cancer, which is really so common in men. About 200,000 men will be diagnosed this year alone.
Okay.
So we're excited to be helping them out and decide how to treat their prostate cancer.
Okay. Dr. Margaret Gallegos from Santa Fe Imaging, thank you. For more information on the MRI and prostate cancer, head to our website at CASA.com, click on the CASA blog.